really fully entrenched at this point in time. The mediator is still involved between both sides trying to keep that dialogue going. But these hospitals are insisting that patients are being cared for, largely because they've spent more than $100 million to house and pay for salaries for travel nurses in advance of this strike. But after 10 days on the picket line, there is no indication that this one will be ending anytime soon. Nurses striking, hoping to pressure 3 massive New York City healthcare systems to meet their demands and bringing in big names to support their cause.
People of this country are sick and tired of the greed in the healthcare industry. Don't tell me you can't treat nurses with dignity when you're spending hundreds of millions of dollars on traveling nurses.
Another deal was already brokered for fellow nurses at 11 hospitals in New York. And this action by 15,000 nurses now stretching 3 times longer than the last time nurses walked off the job for better pay and benefits. This time nurses demanding safety in their workplace, in addition to wage hikes and health care benefit security.
A strike is an act of last resort. What workers want is to be back at work.
New York Presbyterian, Montefiore, and Mount Sinai all without agreements with their nurses, with Mount Sinai saying a near-term path to an agreement is very unlikely, and Montefiore insisting the nurses' $3.6 billion in demands, including a 40% wage increase, are reckless.
We didn't expect this to be this long because other hospitals have agreed. I'm scared for my kids. They're all under my benefit.
Now, Mayor Mamdani pressing the hospitals to get back to negotiations, saying the combined $47 million in annual salaries for the CEOs show that there's room to meet these demands, but still no plans for contract negotiations to resume this week. Dan Hazel, to you.